Okay, Matt, I'm about to take you through the adult pre-exercise screening tool. The purpose of doing this is to gather as much medical information as possible to identify what's called a contraindication to exercise.
Yep.
A contraindication is anything that is present that could cause you harm during training. It could be something as simple as ankle injury or cardiovascular disease. So it could be as bad as cardiovascular disease.
Yep.
I'm going to be asking a few questions just in 2 stages, which once we get past the first stage, we'll go to the second stage. It'll help me identify any contraindications that'll help me plan an exercise routine for you and how hard you can train or how little you can train. So.
Yep.
I'll then be able to work out a proper program suitable for you. The main reason we're doing this is to figure out whether we need to get permission from a doctor or medical clearance for you to be able to actually do the training, just in case there is something that we need to check on.
Yep.
Are you happy to go through this with me?
Yeah, let's do it.
All right, beautiful. Okay, our aim basically is to identify those individuals with a known disease or sign or symptoms of disease who may be at a higher risk of an adverse event during physical activity exercise. This stage can be self-administered, but since I'm here, we'll go through it together. Okay, number 1. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest at rest or during physical activity exercise?
No.
Do you ever feel faint or have spells of dizziness during physical activity exercise that cause you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes, type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
Do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
Not that I know of, no.
Can you sign down here and date for me? That's stage 1 done.
Nice.
Age 31, male, gender. Because of your age, you're not a risk factor with your age and gender.
Yep.
Have you got any family history of heart disease, example stroke or heart attack?
No.
No? Do you smoke cigarettes on a daily or weekly basis?
No.
Describe your current physical activity exercise levels. For how frequently would you train?
Probably 6 days a week.
Yep. And vigorous training or moderate light?
Yeah, pretty heavy.
Pretty heavy, so vigorous. And how often would you train for each session?
90 minutes.
All right. Based on this, you were doing above the recommended amount of training. So this actually gives you a -1 risk factor, which is great.
Sweet.
Can I just get your height for me?
About 187.
And your weight?
86 or so kilos.
Yep. So your BMI is below 30, which you have a BMI of 24. So there's no plus factor there. Have you ever been told that you have a high blood pressure?
No.
Have you ever been told that you have high cholesterol?
No.
Have you ever been told that you have high blood sugar level?
No.
Beautiful. Well, so far you got a -1 risk factor, which is great.
Yeah.
Have you spent time in hospital, including day admission, for any medical condition, illness, injury during the last 12 months?
No.
Beautiful. Are you currently taking a prescribed medication for any medical conditions?
No.
I'm going to guess you're not pregnant, and you wouldn't have been in the past 12 months, so beautiful. Do you have any muscle, bone or joint pain or soreness that is made worse from any particular types of activities?
No.
Beautiful. Well, based on this, it allows... let's cut this part. Yeah. Based on this, you have you're in the low risk category.
Yep.
Is that right?
Yeah.
Because I think it gives you 2 options here. So I'll start that part again.
Yeah. So.
1, 2, 3.
Just because it's
Okay. All right. So it puts you in the moderate risk clients. No, low. Sorry. I'll start this again. Seeing the shit out of me. Okay. This puts you in the low risk clients. Basically, which that means if we go back to this page back here, you'll be able to go to 90% heart rate, up to 90% or even higher heart rate measurement.
Sweet.
So you can basically train quite hard whenever you need to.
Yeah. Sweet.
Yeah, so everything looks good.
Awesome.
Thank you.
Now we have to make. You know what I realised? I didn't want to interrupt.